Assalamu alaikum wa rahmatullah wa barakatuh. Bismillah ar-Rahman ar-Rahim. The objectives of third lecture of inflammation are: first, to understand the chain, progression, or sequence of cellular response in the histological evolution of acute inflammation. Second, how do the leukocytes kill the bacteria and microorganisms? And third, what are the clinical cardinal signs of acute inflammation? We start with cellular response in the acute inflammation. Emigration or migration of white PC or leukocyte. We should know that the type of accumulated white PC depends on the type and severity of injury or inflammation. In acute inflammation, mainly neutrophils pass between the endothelial cells to the extravascular spaces by its amoeboid movement. Emigration of leukocyte is an active process called chemotaxis. How do the leukocyte migrate to the site of inflammation or the site of injury? The stages of emigration or migration of leukocytes are: during the stasis of blood, there is margination and pavementing of leukocytes, mainly neutrophils, on the surface of endothelial cell lining the walls of blood vessels, followed by rolling of leukocytes on the endothelial cells with the transient loose adhesion by adhesion molecules on the endothelial cells, which are called selectins. Selectins cause a transient loose adhesion of neutrophils to the endothelial cells. Then firm adhesion of neutrophils to the endothelial cells by adhesion molecules, which are called integrins, on the leukocyte surfaces, followed by transmigration or diabetes of neutrophils across the endothelial cells by amoeboid movement. Once the leukocytes or neutrophils become in the interstitial tissue, they migrate to the site of inflammation by process of chemotaxis, and then aggregation with activation at the site of the inflammation. Finally, phagocytosis of the microorganism. This picture of venule in acute inflammation, in which there is stasis of blood with hemoconcentration within its lumen, with margination and pavementing of neutrophils along the endothelial cell lining of the wall of the venule. After margination and pavementing of neutrophils on endothelial cells, followed by rolling of neutrophils on endothelial cells with loose adhesion by adhesion molecules selectins, then firm adhesion by adhesion molecules integrins, followed by transmigration or diabetes of neutrophils across the endothelial cells by amoeboid movement. Once the neutrophils become in the interstitial tissue, they migrate to the site of inflammation by process of chemotaxis. When neutrophils reach the site of inflammation, then aggregation and activation of neutrophils, followed by phagocytosis of microorganisms. The process of chemotaxis is defined as an active directional and controlled movement of the inflammatory cells, mainly neutrophils in acute inflammation, along the chemical gradients of the chemotactic agent to the site of injury or to the site of inflammation. The concentration of chemotactic agent are high at the site of inflammation. So, chemotaxins are chemotactic agent or chemo-attracting substances which are able to attract leukocytes toward them, and they are of two types. First, exogenous chemotaxin, which come from outside the body, such as bacterial polypeptides. Second, endogenous chemotaxins, which are chemical mediators that are formed inside the body, such as complement component C5A, and the letter A means active complement component, and leukotriene B4. Certain cytokines, such as chemokine of interleukin 8. So, interleukin 8 is regarded as chemotactic agent. How do leukocytes kill the bacteria and microorganisms? After the aggregation and activation of leukocytes or neutrophils at the site of inflammation, they start to kill the bacteria or any other microorganism by process of phagocytosis. Phagocytosis is a process of engulfment of specific material such as bacteria, microorganism, damaged cell, and tissue debris by specialized cells called phagocytes, which include polymorph nuclear leukocytes or neutrophils. In the tissue, neutrophils are called polymorph nuclear leukocytes, while in the blood they are called neutrophils. And macrophages. Macrophages are more powerful phagocytic cells than neutrophils. In acute inflammation, neutrophils predominate in the first 24 hours, causing destruction of the cells of the tissue, and are then replaced by macrophages after 24 to 48 hours. Neutrophils are short-lived. They undergo apoptosis after 24 to 48 hours, while macrophages survive longer, and they are regarded as powerful scavenger cells in the acute inflammation. What are opsonins? Opsonins are plasma proteins covering and coating the bacteria or particles and promote their adhesion and binding to specific receptors on cell membranes of phagocytic cells by process of opsonization. So, opsonins play an important role in the process of phagocytosis. Opsonins are three types. First, immunoglobulin G or IgG molecule is one type of opsonin. Second, complement components C3b and IC3b. The letter I means inactive complement component. And third, plasma fibronectin or colectins. These are three types of opsonins play an important role in the process of phagocytosis. This figure shows the steps of phagocytosis. The first step is recognition of microbe or bacterium or any other particle which is coated and covered by opsonine. Then attachment and binding to the receptor on the surface of the phagocyte by interaction between opsonine and phagocytic receptor. Then the second step is engulfment of microbe or bacterium or particle by formation of cytoplasmic pseudopods around it. Then formation of phagosome with ingested microbe within the cytoplasm of phagocyte. Subsequent fusion of phagosome with lysosome forming phagolysosome. Lysosome has lysosomal enzymes within granules enclosed by membrane. With the formation of phagolysosome, the third step is destruction or degradation of microbe or ingested particle by releasing of lysosomal enzymes within the phagolysosome, such as nitric oxide and oxygen-free radicals or reactive oxygen species with care of the microbe. At the same time, there is also releasing of lysosomal enzymes to the extracellular space where they can cause tissue injury. After phagocytosis, the microbial killing and degradation occurs by two mechanisms. First, oxygen-dependent mechanism, which is most efficient mechanism in microbial killing and degradation. Phagocytosis stimulates the oxidative burst in the phagolysosome with the production of reactive oxygen metabolites or reactive oxygen species or oxygen-free radicals, such as formation of hydrogen peroxide and superoxide, in addition to the nitric oxide. They are powerful bactericidal agents in microbial killing of bacteria and others, and they can cause tissue injury if they leak out of the phagolysosome into the extracellular space. So, there is a cytoplasmic enzyme which is called glutathione peroxidase, protects the cells of the body by destroying hydrogen peroxide and superoxide that leak out of the phagolysosome. We take an example of tissue injury and destruction by releasing of large amount of lysosomal enzymes, which cannot be counterpart and controlled by glutathione peroxidase because of their large amount, causing tissue injury and destruction, as in gout. In gout, urate crystals are phagocytized by neutrophils and exert toxic effect on lysosomal membranes, leading to the release of lysosomal enzymes, causing injury and destruction of joint tissue, which is responsible for acute inflammation of the joint in gout. The second mechanism of microbial killing and degradation is oxygen-independent mechanism, which is less efficient than oxygen-dependent mechanism, and it is mediated by lysozyme and others. This slide shows in summary the steps of cellular response in acute inflammation. There is margination, rolling, adhesion, diabetes, chemotaxis, phagocytosis, and finally microbial killing. What are the clinical signs or clinical features of acute inflammation? There are 5 cardinal or classical clinical signs of acute inflammation, which are kept in the word or term BRISH. B means pain, R redness, I immobilization, S swelling, H heat. So the clinical signs of acute inflammation are: first, redness or erythema due to the vasodilation and congestion of blood vessels. Second, heat or warmth due to the vasodilation and increased blood flow. Third, swelling or edema due to the increased vascular permeability and fluid exudation. 4. Pain due to the irritation of nerve endings and mediator release. And 5th, loss of function, reflex immobilization due to the pain. The classical clinical signs of acute inflammation were first described by ancient Egyptians 3,000 years before century in Latin words, which are: rubor means redness, color means heat, tumor means swelling, dolor means pain. And then the 5th term was added, which is functio laesa, means loss of function. This picture also shows the cardinal or classical clinical signs of acute inflammation, which are heat, redness, swelling, pain, and loss of function. You see, the wood of inflammation was broken at the 5th patient, who has fractures in the upper and lower limbs, lead to the loss of function, and he cannot carry the wood of inflammation, so it was broken at him. This patient has clinical signs of acute inflammation due to the abscess formation in the neck. There is a swelling in the neck with redness of overlying skin. Also, there is a limitation and restriction in the movement of the neck, means reflex immobilization due to the pain and loss of function. This slide shows the redness and swelling of the toes due to the acute inflammation. The microscopic appearance or microscopic features of acute inflammation that are seen in the tissue section by light microscopical examination, and these features are: first, dilation and engorgement of blood vessels. Second, exudation of fluid. Third, infiltration of tissue by inflammatory cells, mainly neutrophils. And it is monomorphic infiltrate, means one type of inflammatory cells is predominate, which are neutrophils. This is the microscopic appearance or microscopic features of acute inflammation. There is vasodilation with engorgement of blood vessels, infiltration of tissue by numerous inflammatory cells, mainly neutrophils, within the background of inflammatory fluid or inflammatory exudate. This is the feature of neutrophil, which has a 3-lobed nucleus and granules within the cytoplasm, or granular cytoplasm. Many terms are used for neutrophil, such as neutrophil, polymorph nuclear leukocyte or BMN or BML, leukocyte, granulocyte, neutrophilic granulocyte, and polymorph. Thank you for your listening.